back supine from prone. So the first thing you're going to do is straighten out your bed. You don't want them in a 30-degree slant. You want them straight. You want to lower it to a working height. Okay, is that good for everybody? Mm-hmm. We're going to remove this blue sling and kind of tuck it up underneath her body just a little bit. It doesn't have to go underneath. Yeah, and you want to move her arm. Before you do that, you want to move her arm, rotate it out and back, and it's going to go kind of underneath her body. So you want to put her hand underneath her hip. And then you want to roll this sling kind of almost underneath her like that. You have your second sling that's going to go on right here like this. And you can kind of tuck that in underneath this one. And get it as center as best as you can. So this side is going to start hooking her up to the loops on the turning and repositioning sling. They're going to use loop 1 in the center, and then loops 2 for on each side of the center. Don't worry about the loops on the feet, or if you have an extra loop at the head, that's quite all right, because her feet will follow her body. And as the same with the prone, as you start to go up, you want to move her body, pulling the turning and repositioning sling with the turn this way. And they're going to lose vision. So again, we need to help them as we're guiding them over. Okay? And so we're going to say, keep going. And keep pulling her. And you want to watch your arms.
Lost vision.
Okay, and we're going to lay her down. And she's going to be a little off-center, but that's okay because we have the turning and repositioning sling underneath her, and we can use that to recenter her in the bed. So we can take that off, and we can use that to recenter her. And you got your pillows with you here. We might need to roll her actually and get this pad underneath her just a tad more. So we'll have you guys just put some of this blue pad a little bit more this way. And then we're just going to kind of roll her back so we can grab some of this and pull it out. There we go. Okay. And then we're going to use the sling, and we can lift her up and recenter her in the bed.
We don't use this.
Yeah. So we can just lift her up and recenter her as needed. So I think we should have probably pushed just a little bit more that way so we could get her centered. But if this happens when you're turning her, that's okay, because we'll use the repositioning sling to help us put her back in the middle of the bed. Okay, go ahead. Keep going. And there we go. Now once you have her centered, you can leave the blue sling a little off-centered, because when you go to prone her back, you're going to need a little bit shorter on this side and longer on that side, so it's okay if it's a little bit off-centered. You got it? All right, and then you guys can maybe just pull her hips just a tad so she's not in there. There you are.
Then the next thing you want to do is a skin check. So all that Mepilex you placed, you want to look underneath the Mepilex and make sure that the skin is protected. How is it? Do your regular assessment, drips, airway, oxygenation, how well did they tolerate, and you've done it. So we're ready then to wait 4 hours, or some people like being prone, so be prepared to right away prone again. If this patient doesn't tolerate being supine and they were more stable prone, there's always a chance that you would have to go back to a prone position. They just weren't ready yet.